Good afternoon and welcome to Webinar Wednesday. Today we are joined by Dylan Winthers, Network and Cybersecurity Analyst at HSS, and Chad Holmes, Security Evangelist at Scenario. Webinar Wednesday would like to thank our sponsor, HSS. For more than 35 years, HSS has comprehensive medical equipment support services to healthcare facilities across the nation. They are informed by the wisdom of experience and place a great value on smart and informed decision making. Most important, they are deeply committed to serving as a trusted partner, providing independent, reliable, and cost-effective solutions that enable their customers to consistently maintain the highest patient care standards. Since 1994, HSS has been reviewing their customers' vendor service agreements. They help them identify and eliminate wasteful spending. For more information, visit hsstechservices.com. Okay, today's webinar is eligible for 1 CE credit from the ACI. You can obtain your CE certificate by completing the post-webinar survey, which will be emailed 1 hour after the completion of today's webinar. You must complete the survey to receive your 1 CE credit from the ACI, and you'll be able to download the certificate directly from your computer once the survey is submitted. If you have any questions, you can reach us at webinar@mdpublishing.com. And just a reminder, if you've missed any of our webinars, you can view all our past webinars and podcasts on our website, webinarwednesday.live. We'll wrap up today's presentation with a live Q&A, so please submit your questions anytime using the questions feature on the webinar dashboard. Let's kick off today's webinar by giving away one of our brand new Webinar Wednesday t-shirts to the attendee that can tell me the answer to the following trivia question. October is Breast Cancer Awareness Month. What colour is used to represent breast cancer awareness? Answer now using the questions feature on your dashboard, and I'll reveal the answer at the end of the webinar. As I mentioned earlier, Dylan and Chad are our presenters today, and they will discuss exploring the utilization of security tools in a complex healthcare system. Dylan, you may begin whenever you're ready.
Thank you so much. I appreciate it. And thank you all who are attending. I truly appreciate the opportunity. I believe we have a great presentation today. A lot of dynamic topics Chad and I are very familiar with. Hopefully we have the opportunity to educate and provide some additional knowledge, awareness, and experience through today's presentation. As mentioned, we are today discussing advanced healthcare systems, discussing some best practices, strategies, tools, projects, and the like to help better secure your data within a healthcare space. So before we kick things off, Chad, thank you so much for joining me today. I know that we have several topics that we're looking forward to covering, especially as we conclude through the presentation. Please do submit your questions. Each of us do have a unique perspective in several different ways of the healthcare system, its market, industry, so forth. To kick things off, every facility is different, and I cannot emphasize this enough. We see this almost universally across every facility that we work in, whether it be differentiating procedures, documents, practices, so forth and so on. So be mindful that we are truly currently working on a general aspect, and that every facility has an opportunity, in my opinion, to improve on several different procedures, processes, best practices, and we're going to discuss how to do that. So first and foremost, let's establish your plan, and there's several ways to do that, including defining roles. One of the big topics of emphasis that I'd like to touch on here today is ownership. Who is responsible? Who is accountable for the changes that need to be made within your facility that can inevitably help not only the devices, but the patients and the security within the system itself? Establishing goals is another extremely important topic, defining where and what it is that you are trying to reach as an objective. Again, progress is always possible because perfect security does not exist. Documentation is another key component that we emphasize in terms of importance, because it is documentation that allows us to monitor that progress toward our goals. Simulating scenarios and creating situations where we can practice what may potentially happen. So much like preparing and the preparation that needs to happen for any type of event, whether it be an emergency or not, and regardless of what function you perform within a healthcare facility, it is always best to practice before actually doing or executing whatever event or responsibility that you are so inclined to do. Reviewing and reacting. Again, this is going to summarize each of these points in several different ways to make sure that we are capable of viewing and seeing not only the progress that we're making, but also being capable of communicating that to all members of the facility, regardless what department, what level, so forth and so on. So to summarize a couple of main points, again, recognizing ownership, the evaluation of your system in every different way possible, and then creating improvement and moving, again, the system toward increased security. On the screen here is a maturity scale that has been developed that I think majority of what it is that we see in terms of our clients as well as the healthcare systems around the nation can in some way define themselves, whether it be toward the lower end of the scale or toward the upper end of the scale based on the tools, the solutions, the procedures, and the advancements that each facility has made. So each of you have an opportunity now to review this maturity scale, to define where you believe your facility sits from several different perspectives, right? Whether it is your security perspective, whether it's your medical device perspective, whether it is your network perspective. Take a minute to review, and I'll go ahead and actually transition this over to Chad to say, and I think that you'll agree, it is difficult, especially within healthcare, when we see, or at least I have personally, that the majority of the systems that we work with oftentimes fit toward the lower end of this maturity scale. Your thoughts?
Yeah, absolutely. And I think the first thing that pops up before I answer that question is the first time you see this maturity scale, you probably take 3 steps back and say, oh my goodness, I don't even know where to start there. And so it's really important to point out that just because you or maybe even your team doesn't necessarily have the skills to go from level 0 to level 3, there are people out there. And one of the great things we've seen with COVID, right, lots of bad things, but one of the great things is the forced digital transformation, where we have seen that remote workers and remote expertise can help you go from level 0 to level 3 very quickly. And I know from my point of view, it's one of the reasons that our team likes partnering with HSS, because they do have that expertise, and folks like Dylan can scale that knowledge across the board. Now, Dylan, not to ignore your answer or your question there. So getting to it, absolutely, the systems we see put in place within healthcare right now are level 0, maybe level 1 if you're really, really lucky. And the very rough reality is that within healthcare, the technology practices, particularly the cybersecurity practices we see, are about 10 to 15 years behind other industries, right? Healthcare focuses more on patient care than building out really comprehensive and secure IT systems. They're more focused on IT systems supporting patient care. So the end result is we have all kinds of Windows machines, we have all kinds of devices interacting with patients that weren't necessarily designed with security in mind. They weren't always deployed in the most secure ways, and unfortunately, they're not always maintained in the most secure ways. So at the end of the day, that's why attackers are focusing on healthcare. It's a rough situation to be in, but it's really, really important to note that teams like Dylan's at HSS is incredibly valuable in getting you beyond, the very first steps of level 0 to level 2 or 3 in a rather short time frame. Dylan, I'll hand it back to you.
Thank you, Chad. And I agree. It is the unfortunate reality. And I think a major component of this particular presentation and many like it is to create awareness, right? Let's start moving from being reactive as we see down toward level 0 into more proactive or more established processes and tools of deployment, much like scenarios where we can implement a solution that can cross-provide several advantages that are going to help us now drive into a more optimized environment. So tools and talent, and again, primarily speaking, and this is one of the main reasons why this partnership exists between HSS and Scenario, is it is a very well established partnership, I would say, because of the way that we operate. And how we operate is unique, and I'm looking forward to having an opportunity to discuss that a little bit more. But for your individual facility, again, there are going to be several questions that we pose throughout the presentation that, if anything, hope to spark some curiosity or some interest. If you don't have the answers particularly yourself, who can you speak with? Who is responsible? And again, doubling now back to the ownership piece, who is responsible for making these decisions? Who is monitoring this environment? So forth and so on. So what software is in place? What solutions are being used? And how are they being used? It's great to have tools plugged in that create awareness and create data and reports. But then we need to take it one step further to say, okay, how can we turn this into results? How can we turn this into action items that create progress? So again, who is using these software tools? Who is using these solutions, these programs, and are they being optimally utilized? Are they being used to their full effect? Are you getting the most benefit from the solutions that you and your facility have in place? A great example and recommendation that we offer is to use assessments and audits. Several different assessments are available. There are several templates available on the web. There are also different companies and different providers that will grant you assessments, audits, so forth and so on. Again, it is important to have that accountability, to have that responsibility, because it is inevitably only going to drive that improvement. Chad, almost a scary fact, 82% of healthcare connected devices were targeted for cybersecurity attacks. I think that this is, again, the unfortunate reality that we see every day. Your thoughts?
Yeah, absolutely. And devices have been adopted at an incredibly rapid pace, whether it's an IV pump or a CT machine that are there to provide patient care. They are now connected to the networks. They're now outwardly exposed in a lot of cases. And even if they're not the primary attack vector, maybe someone comes in through unpatched window machines, which are ubiquitous throughout healthcare networks despite best efforts. Even if they're not the primary target, they are often used to replicate and execute on attacks. So while 82% of them were targeted for cyber attacks in 2020, more recently, we're starting to see things like 89% of hospitals have had multiple cyber attacks against them in the last year. That was a study that just came out in the last month for a proof point, I believe it was. And more importantly, I think the 11% that weren't targeted actually were probably targeted and just don't know it yet. So not only are environments as a whole under attack, but those devices that provide patient care that are physically interacting with patients are under attack. They're not necessarily directly attacking patients, but the collateral damage that comes from them being taken offline is mounting, and we're starting to see that there are direct impacts to patient care there. So we can't just take these devices and push them aside and say, who would ever attack those? Because they're actively being attacked and actively leading to financial loss, compromise of facilities, and impact on patients. Back to you, Dylan.
Chad, I think what you just spoke to, I think, is going to segue very nicely into this next slide. So the significant challenges that we see within the healthcare industry, first and foremost, is there's so many different devices, and it starts with the connected devices. And something that Chad touched on is the evolution of these devices, right? Decades ago, some of these devices were not communicating across the network. As technology and devices have evolved, now we have more interconnection. We have more communicating devices, communicating either to alternative devices, perhaps back to the EMR or the medical record, so forth and so on. And we're seeing dozens of devices per room, and especially in specialty rooms, that number can easily double. Now, non-standard devices, I think, is an additional piece that a lot of healthcare facilities are not necessarily aware of, or aware that it is as much as they are. So for example, whether a typical or traditional PC or laptop or server access point, there are similarly numbered medical devices or non-standard equipment that are also connected or communicating traffic across the network. I think this next point, I think, is something we can all really relate to, any of us with any type of healthcare experience, that resources are truly limited. And again, as an impact of COVID, we have seen depletions in resources, scrambling efforts to make things happen, to create change. So how are we utilizing our resources to its most beneficial or advantageous point? And there are solutions out there that can be, including coverage over several different sectors, vectors, and threats. Finally, the most important piece is there is oftentimes just not enough information. There's not enough awareness. There's not enough education around what is genuinely happening, not only in the healthcare industry, but also within each facility individually. I have personally had experience where we see several facilities under a complex healthcare system, and though they may be umbrellaed underneath a single healthcare system or entity, each hospital is different in its own unique ways. So how, again, can we create information to rally or to unify toward the progress that we're looking for security, to avoid the attacks that are constantly happening within the healthcare industry? So now, returning back to ownership, who does what and when do they do it? And I think it starts very simply with asking, what if? What if something happens? Create a scenario, create a situation or an event or some sort of incident in your mind, and then answer those questions. What happens if we are seeing irregular traffic? What does that mean? Who's going to do something about it? What happens if a phishing link is activated? How are we going to receive that alert? Do we have alerts in place? All of these questions are incredibly important that inevitably lead to the opportunity, or the lack thereof, to provide patient care. So do people know what they are supposed to do? And I think that in itself is a question that I would emphasize to be answered in every single facility. Chad, your thoughts on how facilities can get started? How can we start defining ownership within a healthcare facility?
Yeah, certainly. So ownership is a big challenge when it comes to security in particular. We did a survey recently that showed there is no real owner for security. Every hospital does a little different, kind of like you were talking about before.
Mm-hmm.
And so the first thing I always recommend people do is just ask the simple questions, right? Who owns security? Do they have the team they need? Do they have resources? What are they asking for? And frequently we see the challenge is that CISOs, Chief Information Security Officers, for example, are brought in, but they're understaffed, they're under-resourced, and they're used as a scapegoat in a lot of cases. If there's an attack, if there's a data breach, they get fired and then get a better job 2 weeks later. And the unfortunate fact there is that's where insurance industry, that's where the banking industry were 15 years ago, and we're just making that same mistake in healthcare. So at the end of the day, if we can ask the simple questions about who's in charge and are we enabling them to do their job, everything else tends to fall in line pretty easily as long as we have the right people there.
Assessments and audits, and I think just as a very brief explanation to understand the difference, an assessment itself is simply put as, what are we actually doing, right? The assessment is getting a general status, getting a visual or a report on exactly what is happening within the facility. An audit, however, is now asking the question, are we doing what we're supposed to be doing? Right? Are we following the procedures that we've defined for ourselves? If we are, how often, how can we increase the percentage of us utilizing that procedure to follow those procedures? Do then those procedures need to be redefined, rewritten, or edited in some way? So almost every single tool has some sort of reporting feature. I cannot emphasize this enough, use it, because metrics matter so heavily within the healthcare industry. So again, doubling back into creating progress. You cannot create progress if you don't already understand where you, I would say, live as a baseline, right? Understanding what your current position is and how we can create progress or improvement, and then procedures to follow that. Procedures that will allow you to establish some consistency, to now identify what are some of the holes in our practices, what are some of the challenges that we're facing, how can we address those challenges, what changes need to be made to the system. All of these questions start with an assessment or an audit to give you that baseline information. So again, let's move into automation. Let's talk about solutions and network solutions, especially relating to the environment as a whole for a healthcare system. It is recommended highly, of course, especially within this presentation, to automate as much as possible, right? Take the tool and utilize it to its maximum efficiency. Create the opportunity of alerts. What happens if? And all of those questions, while we can put them simply in terms of an oral practice, there is also a way for us to configure a lot of those questions or create a way to get those results from the tools that we do put in place. So contact the vendor and ask questions about improvements. So whether you're talking about your physical access control system, whether you're talking about a medical device specifically, if there's this particular model that may be giving you trouble, ask questions, create improvements, and get those answers from the manufacturers who themselves are primarily focused on, of course, the function, and therefore caring about patient care inevitably. I think the bottom line is alerts can save time and systems, and alerts give us an advantage so that we have the opportunity to react as quickly and as gracefully to mitigate as much of a threat as we can. Chad, there are a lot of ways, I think, and a lot of different systems and tools that each facility can utilize for several different functions. As I mentioned, physical access control, including badges, doors, so forth, time clocks, things of that nature. Your thoughts on what we can do and touch specifically, of course, on the scenario product, which is going to give us a passive look at our entire environment, including not only traditional devices, but non-standard devices as well.
Yeah, absolutely. And these last two slides have done a really good job painting a picture of how important data is. And anyone that talks to me for more than about 30 seconds or so realizes I'm a huge data nerd. I love just analyzing anything I can, from Major League Baseball data to healthcare and everything in between. And so we're in this really interesting time where data is flying everywhere. And it's, one, really important to make sure we're analyzing that data and seeing that data, but two, making sure we're presenting it in a really, really concise way. And that's where dashboards become very, very useful, as Dylan was pointing out in the last slide. And again, that can sound a little bit intimidating. So the first thing I always recommend folks do is take advantage of the full services your vendors give you under your contract. I've been on the vendor side of software and security for most of my career. And I'm always surprised how people don't fully utilize technical account managers or customer success managers or free training. It's something that you have a right to. It's something that can really augment your team and make them more useful. So I recommend everyone in this middle point here, make sure you're getting the most out of your vendors and actually push them a little bit more. You'll be surprised how quickly they can turn around new dashboards, new data, new services, new training under the contract you currently have at no cost to you that gets your team up and running. And then more importantly, make sure that when you are getting alerts, which are incredibly valuable, that you're able to tailor and manage them in some way as well. I know our team, we have something called Scenario Live, where it's incredibly brilliant researchers that sit there and they analyze the traffic we see going across the wire. And I'll talk a little bit about how we do that. but they're also weeding out large numbers of false positives, right? They're making sure that the only alerts that our customers see are the ones they actually have to act on. So alerting can be a bit daunting. It can be tough if you have systems that aren't properly tailored to weed out the noise. So always make sure you're pushing your vendors to help you as much as possible, because I think you'll be really, really surprised about how much help they're willing to give.
Exactly right. And I think another point of emphasis to that exact point is that this is not exclusive to any one position or any one individual, not exclusive to any one department even. Everyone has the opportunity to reach out and inquire, ask questions, contact the manufacturer. Nobody is limited in the education and the curiosity to, again, improve what it is that you as an individual provide to each facility, or to any facility, I should say. All right, arguably the least fun slide of the entire presentation, yet somehow in my mind, one of the most critical. And it starts with documentation. We talked several times about assessments and audits and what those practices can do, the results that they can provide. But again, establishing and reacting thereafter based on the information provided from those reports, what can we do and what can we put in place to give us the progress that we're looking to make toward the goals that we've established. And policies, procedures, and playbooks are going to be the answer. These are incredibly important. I recognize very daunting and somewhat intimidating for some. Admittedly, much like Chad's data analysis, I myself am a document nerd. So I know that these don't seem exciting to a lot of people, but there are those of us unique individuals out there that do work policies and procedures and want to develop them to, again, generate progress and put in position playbooks that are going to help establish an action plan. I won't go through each and every single individual line item, but again, I do want to stress the importance of these documents. Additionally, and in a very similar way, this is not exclusive. There should be already policies and procedures in place. I can't say the last time that those policies or procedures have been updated, but that might be a really great question for you to answer, or seek the individual that would have that answer. Because again, being reflective, having the opportunity to go back and make changes and make progress in your facility based on new information. A procedure that works today may not work tomorrow, and therefore does need to change and shift. Identifying who's responsible for managing and owning those documents, again, is a great start. And asking those questions is, again, not limited or exclusive to any position within the facility. Another piece initially talked about is simulate and practice. There are all kinds of ways to practice your trade, regardless of what department you're in, regardless of what position you hold within a facility. There is an opportunity to practice, create simulations, do exercises, provide education, receive education, so forth and so on, that will inevitably help you in your role, not only as an individual, inevitably, however, leading to the success or the benefit of the facility itself. So, asking questions. If everyone has a role, do they do it well? And if this just happened, what now? What are we doing? How do we fix an anticipated or simulated problem? Additional questions that anyone has the opportunity to ask, and inevitably only leading to the benefit of the facility. Reviewing and reacting. Again, the kind of umbrella piece or note initially talked about is, how do we create progress? And that, I think, starts with a very uncomfortable feeling, is daring to fail, asking questions and deciding on well, what if this happens? And somebody creates a solution or has an answer to that question. It doesn't necessarily mean it's always going to be right or perfect. I don't think perfect exists, but at least there's an opportunity to reflect. And you're trying then and failing. And if you are failing, that means that you've created a new opportunity on how to learn to do something better. Exploring weak points, making minor improvements. This again, I think is a very, is a cycle that all of us can introduce into our day-to-day routine and inevitably the practices of the facility, regardless of what it is that you provide as a function. Chad, again, data is everywhere. Data, 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 mountains and mountains of data. How best or what should a facility look at prioritizing in terms of reviewing data?
Yeah, and so first of all, as anyone listening might expect, when Dylan and I get together, it's a real fun night as we talk about data and documentation. But I want to hit on this first point, which is daring to fail. It can be scary sometimes. The reality is that it's more about getting results at all. Suboptimal results are better than no results at all. Very rarely are you going to fail in a way that makes things go backwards, right? There might be a blip on the radar here and there, but the reality is if you take action, things are almost always going to get better, particularly when you're behind the 8 ball on security. In terms of what data people should be looking at, it really depends on your situation. But when I talk to HDM teams, biomeds, clinical engineers, et cetera, I just talk about, what does your patch management process look like? Specifically, how often are you spending time searching for a device rather than patching it or maintaining it? That alone can show you how much better you can improve your efficiency. And that's not to say that you're an inefficient group if you're an HTM group that's spending a lot of time searching, but it shows that we can give you more info about where a device is, where the patch is, how to apply that patch, how to do it en masse. Things like that are incredibly valuable to get teams going. More on the security side, actually looking at what's happening at the network level through a healthcare lens. All too often we see products that have been built for other industries put into healthcare environments without recognizing the unique factors and unique challenges to healthcare. So making sure we're analyzing data from a healthcare lens and saying that, if two IV pumps are communicating in a really weird, really fast way, that's probably not normal. And that might actually be malware trying to replicate, just as an example. So understanding that we have to take the technology that's available and standard in a lot of industries and then shift it a little bit to make sure that it is focused on healthcare, that's where we need to really focus our energy on data analysis at this point.
Speaking of analysis, another great transition, passive analysis, and discussing what that means. Again, addressing this to the unique challenges of a healthcare system. The healthcare industry itself is truly unique, and we can do probably, Chad, we could probably do a whole webinar on the uniqueness of the healthcare industry itself. However, the analysis piece is going to be something that is critical to every facility in several different ways, again, touching on the multitude of data that is available. Chad, your thought on, as an analysis expert, what the importance is of the analysis to a healthcare facility.
Yeah, absolutely. And so one of the big benefits we have in healthcare right now, again, is all these devices that are very chatty. They're putting traffic on the wire all the time. We don't want to necessarily analyze that data in exact real time, right? We don't want to put things that would block communication. So what we can do is something called passive analysis. And this gives us near real-time analysis of copies of traffic. So think of it this way. Think of you have multiple gigabytes going across your network every day. We can take a copy of those gigabytes, analyze them on a different machine, completely discard the EPHI because frankly, knowing someone's weight or hair color or medical history does not help us figure out if a device is under attack, for example. Analyze that on site without exposing EPHI, and then do something called deep packet inspection that allows us to understand better about the devices we're seeing and how they're interacting. And Dylan, if you want to go to the next slide, I'll talk a little bit more about that. Because it's really important to understand that the analysis provided by Passive Insight is one of the keys to making huge steps in healthcare environments when it comes to security. First of all, what it can do is it can give us a full device inventory. It can say, you already know your Windows machines to some degree. You've brought in thousands and thousands of devices. As Dylan said earlier, there's dozens of devices per bed in hospital that are connected to networks. But in many cases, you've done little to nothing to really secure them in any way because they weren't seen as a threat. Well, now we know that attackers are heavily focused on them. But because these devices are so chatty and because they're sending across all kinds of information, about 150 data points each, when they send packets of information, we can start to understand physically where a device is, what the serial numbers are, what the patch level is, what the manufacturer is, all this rich information that can help us better understand not only what we have in our environment, but what it's communicating with and what risks it may be introducing as well. And so all this information, again, if tailored and whittled down correctly to provide information to IT, HDM, and other colleagues in the hospital, all that information can be incredibly helpful in not only providing insight into what you have, but the status of those devices and how you can quickly secure them. Dylan, any thoughts on that?
Yeah, definitely. And I think that what I'm hearing specifically is a primary advantage is what we're doing is creating efficiency, right? We're creating the opportunity to stop wasting time, to minimize wasted time, and therefore creating more time for the priorities of your own individual position. Nobody wants to spend time individually picking up a single device for a single data point, if there's an opportunity to capture that in an overall solution. So again, efficiency itself is something that I think can be multiplied by solutions available out there. And so again, therefore minimizing your own bandwidth, right? Creating the opportunity for you to focus on what is important to you and your function within the facility. So talking about not just the basics anymore, let's take one more step further, and we've, I think, overemphasized this in plenty of different ways, but because healthcare is different, there have to be unique opportunities, unique solutions put in place. Chad, your thoughts on not only proactive, but reactive approaches and solutions that healthcare facilities can put in place?
Yeah, and I'll give you one of each as we lead into the next slides. So the number one proactive approach I wish more healthcare facilities would use is something called segmentation or microsegmentation. It's well adopted in other industries, and effectively it means that devices only talk to other devices that they should be. Some people have tried to do this and they've done it successfully. In a lot of cases, they've either tried and failed or just not been as good as they should be. So the number one proactive approach to protecting your environment should be network segmentation to some degree, and that's one of the core parts of our offering. That can sound challenging, but again, it's something that folks like us, HSS, can roll out rather easily. Another protection that we really like to see is something called attack detection response. And what we found is that the unique situations of healthcare allow us to actually analyze traffic in real time and see where abnormal traffic patterns can indicate attacks. And so if you have that kind of day one line of protection, it can help you make sure that anything that sneaks through the protections you already have is caught very quickly. And Dylan, if you want to go to the next slide, we'll talk a little bit more about each of these. And so, of course, before we jump to any of those deep technologies, inventory and visibility is absolutely critical. This is something that you get as part of microsegmentation projects. It's something that you get as part of attack detection response. But I have to make it really, really clear, while this is necessary, it's not sufficient by any means. One of the challenges we see with a lot of customers is they say, hey, we bought the technology 2 or 3 years ago. At the time, it was best of breed. But we've really struggled to go beyond inventory. It gives us a highly accurate inventory. We know the devices. We have some idea of physically where they are. But we're having a really hard time taking the basic security information we're finding actually acting on it. So you have to have inventory and visibility, but you have to also acknowledge that it's not enough. And if we go back to what Dylan was saying about assessments and audits, those are absolutely critical. You have to start somewhere, but having an automated system in place that adds on top of that and does real-time or near real-time analysis that gives you the up-to-date inventory is really valuable. And Dylan, can you talk a little bit about how your team uses this inventory to help your customers' environments?
Yeah, absolutely. Awareness is a perfect first step. The next logical step is action, in saying, what kind of assessments can we utilize within these platforms? Okay, we're getting at the most basic level, here is our inventory. Sometimes there are going to be discrepancies even in inventory, right? There are going to be manual inventory processes or platforms, CMMS platforms, for those of you familiar with biomed, that are very manually driven versus the inventory that is captured via network traffic. So the discrepancies there alone is an opportunity to create what I'm going to say is an added benefit to cross-reference those data sets so that we have a more complete, more authentic, and true understanding of the inventory. Again, even at the most basic level. Now expand that, take it into more complex features or topics such as patch status, vulnerabilities, so forth and so on. So Chad, when it comes to visibility, being capable of seeing more than just the inventory, more than just a serial number, especially in today's environment, is critical.
It absolutely is. And let's jump to the next slide and we can show you how this leads into security, but first it stops at HDM by providing insights to HDM teams on how to do their job better. Because as Dylan, you were talking about CMMSs. I know you've presented, I've presented with folks from Nuvolo and others where they dive really deep into the onboarding process and how they track information and how they get manual data in there. Well, we can also supplement that data to provide even deeper insight. So it's not just here's a device, but here's 150 data points on a device, and you can filter out the ones you don't care about. We don't want to overload you. But also here's a known good format for the MDS2, right? So if you want to go and put a standard security deployment on it, the MDS2 can be right there. We can also show you things like usage patterns. So we can say, hey, this device at 2 o'clock on Tuesday afternoons for whatever reason is underutilized. That's probably the best time to take it down, do your updates, and put it back online. And then we can give guidance around patch status. And then one of the coolest things we're seeing across the industry, whether it's RTLS, whether it's Wi-Fi integration or some other means, giving the physical location of devices is incredibly valuable because it means less running around and it means more working on devices, and everyone benefits from that. And Dylan, if we want to move to the next slide, that transitions really, really well into some of the security practices. And so the first thing that this insight, the first thing this insight provides is things like contextual awareness of the network traffic, things like attack detection and response. Because the sad fact is a lot of technologies that hospitals are using for IT security are focused on a specific vintage of Microsoft Windows machines. It's about a 15-year-old gap. Older machines may not be covered in there. We see a lot of Windows 10, and a lot of medical devices aren't Windows devices at all. Only about 10% are Windows devices in some way, meaning that just traditional approaches to monitoring Windows devices just don't work. So what we can do with passive analysis is actually start to see abnormalities within network traffic that allows us to detect attacks. And because we work with research teams to analyze those attacks and work with teams like Dylan's team to make sure that the folks on site are addressing them as soon as possible, it gives this brand new level of protection that hasn't been seen elsewhere. And the really cool example that I love to give as of 2 weeks ago is we were working with a customer. We saw a malware attack enter the system. Within 2 hours, that device was quarantined, taken offline, set back to a known good configuration, and put back online. The only reason that took 2 hours is because it took us 45 minutes to get in touch with our contact who was in a meeting and had their phone off. So the reality is this level of analysis at the network level, if done under the right scope by the right team members, can stop attacks before they spread and sit in an environment for 3 to 6 months, and just make sure that they're caught early on. It's kind of like catching a cold before it gets too bad, or the flu before you have to sit out for a week at work. So things like this give us a front line of defense. And Dylan, anything to add there from what you've seen in healthcare in terms of attacks?
The unfortunate truth, and I think that we've touched on this quite a bit, is that there are so many devices that are capable of exploitation, right? And so because there are so many devices that are capable of being attacked, how can we, in two parts, not only be progressive in saying, okay, what can we do to minimize the likelihood of being attacked, but also when attack does happen, how can we stop it or minimize the potential damage that is done to the entire facility? So Chad, you also mentioned microsegmentation, and I couldn't agree with you more. And some of the things that we see even in our clients is the almost bizarre configuration or setup that some of these devices have. Some devices, for example, communicating even on, a guest network. We're seeing, non-standard devices that are communicating on dedicated network connections. So how have we gotten here, and what can we do in general to help improve this condition?
Yeah, how we've gotten here is a pretty simple answer. Unfortunately, we've adopted a lot of technology that improve our ability to provide care. That is a net good. I want to be clear. All these devices do provide better care than, say, 20 or 30 years ago. But we've adopted them without actually thinking about the security concerns at all. If you look at most of the cybersecurity motivations in hospitals, it's data theft prevention, right? And that goes back to motivations from 2009 in the High-Tech Act, where it was pushing digitization of patient records. And the worst that anyone could think of at that time was what happens if patient data is exposed. So that's been the motivation behind a lot of security practices in healthcare up to this date. So unfortunately, we're really behind the 8 ball here. The good news, as I mentioned earlier, is that we can learn from other industries and then put on a specific healthcare tilt. And one of the reasons that other industries don't get impacted as much by cyber attacks like ransomware is because they have their networks really, really well segmented. And the simplest way to think about segmentation is this. When a surgeon goes into operate, they scrub down completely to make sure they're not bringing germs into that operating room. Segmentation operates the exact same way. We're putting up walls between communication layers so that devices can only talk to other devices, right? So for example, if you put 1,000 IV pumps in one VLAN, they can still talk to each other. An attack can replicate throughout all those devices very easily, and then maybe jump into other VLANs if things aren't configured correctly. So by putting up basic rules to block traffic and communication only to devices that need to communicate with each other, we greatly, greatly, greatly cut down on the ability for attacks to replicate. And that's really important to recognize. We're never going to stop all these attacks, right? The attacks will keep coming, but the ability to catch them early and then how we react and how we protect against them spreading is how we greatly improve the security posture of hospitals in very, very short order. And so I can dive into a little bit more detail if anyone wants to learn more offline, but do know this is a standard practice that with a slight healthcare tilt can greatly improve your security posture. And Dylan, I'll hand it back to you.
One of my favorite almost comedic metaphors when explaining microsegmentation is a zoo, right? We don't put zebras in the lion enclosure. Well, we put lions in the lion enclosure, right? And there can be dramatic problems that are generated by not utilizing microsegmentation, especially for the zebra. So research and innovation as we continue, there is constantly new procedures, new data, new information that is becoming available almost on a day-to-day basis, right? how are we improving ourselves, what kind of data, and how can it be utilized in both positive and negative ways, depending on whose hands it is in. Chad, especially with a healthcare focus, speak to a little bit, if you would, about the innovation.
Yeah, absolutely. And the reality of attacks on healthcare is that the attackers might be evil, but they're not stupid. They're constantly evolving their attacks to drive revenue. Ultimately, at the end of the day, they're just trying to drive more revenue. And to give you a great example of that, we've seen the evolution of attacks go from just stealing data and selling it on the black market to stealing data, then encrypting systems with ransomware. So if ransom isn't paid, they can still sell data. If the ransom is paid, it's a quick path to revenue. And we've recently seen an evolution where attackers are now taking individual patient information, contacting those individual patients and saying, hey, if you don't want your medical records out there, particularly these really embarrassing or really concerning ones, you might want to pay us as well. So we have to make sure that we're not just reacting to what any one vendor, any one technology, any one provider is seeing, but also looking at it as a whole. So one thing that our team does is we do a lot of independent research. We also do a lot of analysis of the greater data pool of all the traffic, all the devices, all the information we're seeing, obviously in a heavily anonymized way. And what that allows us to do is shift our products from a healthcare focus, which is a bit more reactive, to healthcare innovation, which is a bit more proactive. And that allows us to do things like offerings like active attack detection that I'll talk about in a second. We're also starting to find in the last month or so that for the amount of time and money and consultants that hospitals are putting in protecting EPHI and finding systems, and making sure they're not exposing data, there are still many, many systems that are exposing data that hospitals are just unaware of despite that big investment. And PACS machines are a great example of that, where there was a breach about a year and a half ago that exposed 1.3 billion with a B patient images. And we're finding systems like that all throughout our customer environments. And so by doing this independent research, cross-referencing it with the data we have available, and then feeding our research team on what else to look at, we're starting to really innovate more quickly than was previously expected by our team. Dylan, if you want to go to the next slide, I'll talk a little bit more about that. And one of the main things we always encourage people to do is start with something we call AAD, or active attack detection, which I just mentioned. Effectively, what this is a quick deployment that comes with no cost or no commitment. We want to help hospitals get to a secure baseline. We'll figure out the commercials with whoever's important with that later on. But this will detect active attacks. A lot of people don't realize that attacks sit in an environment for up to 6 months before they finally pull the trigger. They're collecting information. They're getting ready for future attacks if you don't pay a ransom, for example. This active attack detection also identifies points of exposed EPHI. So if you have a system that is intended to share information with outside sources for whatever reason, but that may have default passwords, or it may have unpatched vulnerabilities that you don't know about, we'll identify that as well. And as we go through, we'll quarantine malware-infected devices and also give you your initial snapshot of what your inventory looks like. So again, this is a good way for teams to baseline their security practices, understand where they stand, and then figure out how you can better address the risk you're seeing. Dylan, I'll throw it back to you to wrap up.
Yeah, definitely, and perfectly timed as we finish up here today. Chad, thank you so much for joining me. Having this discussion, I know, is very important to both of us on how we can help educate and create awareness within the healthcare industry from several different facets is what really drives me personally, but also Chad, I know that's a major motivator for you as well. We have allotted time for questions. So if you do have questions, please do have the opportunity to ask. If something comes up in the near future, perhaps something in 10 minutes or 2 days, so forth and so on, please do feel free to reach out. We're always happy to have that discussion.
Great. Thank you so much, Dylan and Chad. We got time for a couple of questions. One that's come in is, if we're just getting started with securing medical devices, where should we start?
That's a great question. Asking questions, right? Creating the awareness to say, okay, we know that this is an issue. How do we solve that problem? Reach out is the first and foremost answer. So individuals like Chad and myself, we love to have these conversations, and there are individuals like us that have answers to the questions that you are looking for. Chad, any additional insights?
Yeah, I love the simple questions recommendation, because simple questions like who owns this in our organization are going to become very revealing about where there are gaps very quickly. The other thing I would recommend is make sure as you're going through the exercise of discovering all the devices, make sure you understand how that will extend to protecting them. Because just an inventory without clear next steps is something where you know the devices that will be attacked, you just don't know how to protect them.
Okay, well, another question here is, what should the role of a biomedical engineer be in security hospital devices?
Yeah, another great question. I think every individual within the healthcare facility has an obligation to creating not necessarily the solution, but again, asking those questions. So what role does a biomed tech have in this industry? And that it starts with, again, asking questions. Who's responsible for this, right? You have the opportunity to educate yourself on some of the industry challenges, right? We've discussed a couple of them today, some of which you yourself may already be familiar with, right? Gosh, inventory isn't lining up, or sometimes our data points are a little askew. I'm spending so much of my time on a wild goose chase looking for a device that hasn't been seen in 6 months, so forth and so on. Each of us have our own unique challenges. So creating answers or finding answers, I think, is a perfect way to start. So is there a specific answer to what does your role or what should your role be doing is going to vary, but finding and seeking answers in education is a great first start. Chad, your thoughts?
Yeah, I'm going to go with something that's a bit more on the softer skill side. A lot of environments we see, there's a natural tension between the IT team and the biomed team. Effectively, IT teams opens a lot of tickets, send them to biomed, say fix these, and then keep bugging them. Why isn't it fixed? Why isn't it fixed? So I would say from a biomed perspective, as hard as it may be sometimes, reach out to the IT team, schedule lunch and learns, schedule mutually beneficial sessions where you can look at them more as team members rather than some kind of hierarchy that's become tense. Not always easy to do that, but it's something that we found has helped increase productivity because both sides start to understand the unique challenges they're facing.
Okay, we've got time for one more question I'll squeeze in. Why is healthcare such a big target for cyber attacks?
It's a great question, and the unfortunate truth is the revenue that's capable of being generated. IBM puts out an amazing annual report. If you have the opportunity to view it or research it, it's called The Cost of a Data Breach. And it is unanimous and universal, not just in the United States, but globally, that healthcare is by far, I think to the tune of like 3 times second place, the most opportunity to and expensive, I guess is what I'm trying to say. The data that is captured from a healthcare facility is very, very expensive. Ransomware, they can often ask so much more money than they could from an additional sector. So the unfortunate truth is it's just worth more. Data in the healthcare industry is just worth more. Chad, your thoughts on this final question?
Yeah, and I'll wrap up with this. We like that report so much that the group behind it, the independent research firm Ponemon Institute that does the survey, we partnered with them as well and found much deeper depth beyond that great IBM data breach report. At the end of the day, healthcare doesn't have as many protections as other industries. Patients' lives are at risk, and therefore healthcare is more willing to pay ransoms. So attackers are evil. They're not dumb. They focused on an industry that drives revenue for them. That's the simple answer of why we're seeing attacks.
Okay, great. Well, we're coming up to our hour. So any questions I receive, Dylan and Chad, I will send you afterwards and you can answer at your own convenience. So thank you again, Dylan and Chad, for your time today and for a great and informative presentation. I'd like to encourage everyone to visit today's sponsor to learn more about the products they provide to our interests, to our industry, sorry. Visit hsstechservices.com. As promised, the answer to today's trivia question is pink, so congratulations to our winner, Paul Graham. Also, a quick reminder, you can obtain your CE certificate by completing the post-webinar survey, which will be emailed 1 hour after the completion of this webinar. You must complete the survey to receive your 1 CE credit from the ACI, and you'll be able to download the certificate directly from your computer once the survey is submitted. If you have any questions, you can reach us at webinar@mdpublishing.com. We'll be back next week with another webinar, so please visit webinarwednesday.live for more details and complimentary registration. Thank you once again for joining us. Enjoy the rest of your day and have a good evening.